Well, just so that we have time to get through all of our content, I want to get started. But we'll start with an introduction, and that'll give people some time to join us. So, welcome. Hello, everybody. Thank you for joining Teen Health in Pandemic Times. My name is Rebecca Edwards, and I am the coordinator of the Easthampton Healthy Youth Coalition. So the coalition started in 2007, so we've been around for a long time. In 2013, we got the Drug Free Communities grant, and then we are now in the 7th year of that grant. So the past year or so, we have spent a bunch of time looking at our mission and our vision and really doing some internal work with the coalition. And now we are excited to say that we are really ready to put out some programming for the community. And so this is our first event that we are promoting based on what we've heard from Easthampton families, that there's a real need to talk about health right now for teens. And that is, of course, our focus as a coalition. So we wanted to put out this panel event for you to hopefully get some of your questions answered and asked and answered, and hopefully bring back some helpful information to support your family. So I want you to know that the vision of the Easthampton Healthy Youth Coalition is to strengthen the lives of Easthampton youth through connection, communication, and community. Our mission is helping youth make healthy decisions, preventing substance use, avoiding other risky behaviors. We work together to foster increased awareness, active youth and family engagement, and community involvement. So that is what we're about. And we are really excited to connect with both Easthampton youth and Easthampton parents. We are looking for parents to join our executive committee. We need 2 parent representatives, and we are also hoping to start a parent advisory board to help us focus our work and help us be able to increase our capacity and accomplish more. So if you are watching this and you are interested to learn more about what we do, please get in touch through our website. You can email me directly. I will put my email into the chat box. Again, our website is Easthampton Coalition. Wait a second. I just need to make sure I get this right. Our website is easthamptoncoalition.org. And thanks to Cider House Media for helping us create that website. We just launched it. So please check it out and get in touch through that website. So the first person I want to introduce tonight is Heather Warner. Heather is the Spiffy Coalition Manager. Spiffy is a local coalition that works with all of the coalitions in the region, and they also work with all of the school districts in Hampshire County to collect youth health data every other year. Spiffy is also one of the organizations represented on our coalition's executive committee. So Heather is here to share some data with you that is very timely and relevant.
Hi, thanks everybody. I'm just going to take 1 second to share my screen, and it'll take me a second to put it on presentation mode, whatever. Alrighty, so yeah, so I wanted to share some of the data that we just recently collected, and the survey was actually administered between March 15th and April 15th, and it is collected from most school districts in Hampshire County, including Easthampton. And, you know, we really couldn't collect this data without the support of the Easthampton Healthy Youth Coalition and the school departments. Today, I'm going to go over some trends in youth substance use. We're going to look at some of the impacts of COVID on young people, some mental health data, and some information about school connectedness and learning during COVID. Just a snapshot, again, we survey 11 districts this year. We survey grades 8, 10, and 12. Some school districts like Easthampton also surveyed some 7th and 10th graders. In Easthampton, they did that in mixed classrooms, and so there wasn't really a full cohort sampled, so we're not including that in today's presentation. Over the county, we survey over 2,000 students, and in Easthampton, just grades 8, 10, and 12, we surveyed 246 students. We have 14 years of trend data, and you'll be seeing some of that. And a lot of people ask about the honesty and fidelity of the data. And I won't go through everything that we do to clean the data, but we do have questions about how honest they were on the survey. We can look at things like if a student says they have never used heroin, but they used it 40 times in the past 30 days, then we can look at those disparities and then pull that entire survey. So we do look at it, and we also see that every school district, and the county, like when I was going through and adapting this presentation from the county data over to Easthampton's data, there were actually some data points that I barely had to change because they're pretty much the same. It's really interesting that way. We see the trends, and we know students aren't all lying in the same direction. And I take some time to explain that because people really do think, oh, the kids are just lying. And really, most of them take it quite seriously. So we're, and those that don't, we find them and boot them out. But there are some considerations during COVID. And a couple of those considerations are that, I don't know about you all, but I can't remember what I was doing a month ago or a year ago. Time is just warped during COVID. And so recall is an issue, but that's going to be an issue across the board, and it's just something we have to consider. And there's other considerations like who is actually in school that day and who's getting surveyed, who's on the fringe and just not able to participate. And we are missing some of those students, and we can acknowledge that. So as we dig deeper, we'll continue to think about those really unusual circumstances that we're surveying under this year. But I'll start by just giving you a snapshot of some of this is 8th grade, and these are substance use trends since 2007. And the good news is, and you can see it especially with the higher grades, that there's a general downward trend in substance use. We started to see an increase in marijuana use across the county. That really isn't true here among 8th graders, but like a county-wide, there was a greater increase in marijuana use. So we also are noticing, and you'll see it again in the high school chart as well, that COVID really reduced substance use among teens at all grade levels, and including vaping, which is just really interesting. And we can talk more about that. I think those young people that are still vaping and using substances are probably those who are more dependent or have become sort of addicted to those substances or heavy users. So this is 10th and 12th grades combined. And again, the yellow line is alcohol, and we don't have 2007 data for Easthampton, but starting in 2009, there's a nice downward trend, started to go up a little in 2019, and then COVID is this downward trend, but we don't know if it'll stick. There's some indication that even though the use has gone down, the attitudes toward it have stayed the same. So unless we catch this moment and think about how to talk to young people about the fact that they're using less and maybe feel better and have some positives that have come out of that, we might miss an opportunity. The red one is the prescription drug misuse. We might have thought that would go up during COVID because of the access issue to medicine cabinets and, maybe more medicine in the cabinets because people are medicating around stress or other things, but we did not see that happen. The blue line is traditional cigarette use. As we see that when usually there's a relationship between e-cigarette and cigarette use, and so we're seeing that increase a little while and oftentimes that's an access issue. And then the marijuana, you can see was steadily going up, and then COVID has driven it down, but we should really pay attention to that in the coming years. So we also asked students, what, if anything, has changed for you during the pandemic? And this is all grades combined. And we also haven't had time to really cross-tabulate this by race or gender or income. It might be different for those subgroups. But when we include everybody all together, we see that more students that 42% of students are getting less physical exercise, while 21% are reporting they get more exercise. Oops, my little window is in my own way of reading this. Screen time has obviously increased across the board. And we also have very specific questions about how many hours of screen time students have used. And so we can dig deeper into that. Sleep, 46% of students say they have less consistent sleep, while 39% say it's unchanged and 15% say it's more consistent. So in terms of remote learning, we asked students, how easy or difficult has it been to get your schoolwork done with remote learning? And 19% say it's been easy, 43% say it's okay, and 36% say it's difficult or very difficult to do their schoolwork. And then how has remote learning changed how much they're learning? And this was sort of interesting and, difficult to hear, is that, 49% of students are saying that they're learning less during COVID. And there was a little notation at the bottom that only 2% of the students who took this survey were taking it from home. We're taking it from school. Most of them were doing this survey from home. I will say that when we administered it, it wasn't done as homework. It wasn't done like in a free period. It was a proctored classroom setting for doing this. So we also asked about school connectedness, and I think there's some, good news in here too. We asked, is there someone in your school, a teacher, coach, administrator, who notices when you do a good job? And almost 70 or over percent said that that they notice when they're doing the job. There's people that they can talk to one-on-one, about 65%. There's an adult who cares about you. Over 80% of Easthampton students said that's true for them. They can go to these adults for help with a school-related problem, again, over 80%, and with a personal problem, 59%, which is really good too. So we also said, what, if anything, has been true for you since the pandemic or with the pandemic? And here, this is divided by male in blue, female in red, and then the total. We, at the county level, also look at transgender and non-binary students, but there's not a big enough cohort here to do that. So many students, and you can see a trend here, that the risks here are much greater for girls and young women than for the boys. So girls are more likely than boys to worry that that they will get sick from COVID, or that a friend or family member will get sick from COVID. 40% of boys and 60% of girls feel lonely and isolated more often now. 30% of boys and 55% of girls feel sad and depressed, more often. And I'm not giving exact numbers here, so I know it's being recorded. Don't quote me on those. And then, girls are feeling a lot more anxious than the boys as well. And stress level has gone up in the family, according to over 40% of boys and almost 60% of girls. Oops, I went backwards, sorry. So we also ask specific questions about depression, and there's another slide after this one, but this shows a little bit of the trends. So it's not just COVID that, has has made depression an indicator of concern. That was already a concern and heading upward in 2019. And this is Hampshire County data. I didn't have time to really tease this out for Easthampton, but we can do this for Easthampton as well. And of course, you can see here where we've brought out at the county level, the transgender, non-binary students, are even at more risk for depression. So this is concerning, and I know people know that, and that's why we're here tonight. We also have questions about feeling, so this is just Easthampton, so this is Easthampton's data, and we see that almost 60% of girls and almost 50%, 36% of boys feel sad and depressed most days, even if they feel okay some days. And 72% of girls and 44% of boys feel nervous and anxious most days, even if they feel okay some days. 17% of girls and 5% of boys seriously considered suicide, and 14% of girls and 3% of boys engaged in some sort of self-harm without the intent to, be suicidal, but that could include cutting or burning. And so we also asked, when I look to my future, and we added 2 categories, I expect to, plus I hope to. And we see actually that despite depression and anxiety, students are relatively hopeful about their future and what they may achieve. So 99% of Easthampton students expect to graduate high school. 19 would like to attend a trade school. 88% attend a 4-year college. 7% join the military. 98% expect to have a job that will cover their expenses. 91% expect to marry or have a partner. 86% would like to have a family, and 98% expect that they could purchase a home. I just also wanted to, I guess I mentioned at the beginning, we can cross-tab this by race and gender and income, LGBTQ status. There's a lot of a deeper dive that we can do in this, and I know that Rebecca is interested in doing that, so stay tuned. I'm sure there will be more data available to digest. And I think that's it, and I think questions are going to be taken at the end. I will stop sharing.
Thank you, Heather. That was great. And yes, actually, the coalition has a data working group. And so if anybody is listening who really likes to work with data and for whom that's a strength or an interest, please get in touch with me. You're welcome to join our data working group. We did just get this data. So like Heather said, this is a very preliminary look at it. And so there's a lot of work that's going to be done around this data over the next few months. And all right, so I'm going to introduce the next person who's part of our panel. This is Amy Hart. She has worked in the field of public health for nearly 30 years, primarily as a health educator across various populations and settings, and more recently as a public health nurse. Her experience with child and adolescent health began while serving in the Peace Corps in rural West Africa. For the past 5 years, Amy practiced psychiatric nursing with personality disordered patients, mostly those ages 18 to 30 with significant childhood trauma, as well as addiction, self-harm, and suicidal histories. So, Amy, we would love to have you take it away.
Hi, everybody. Thank you so much, Rebecca, for inviting me tonight. I'm going to share my screen. Gosh, this is presenting me with more choices than I thought I would get. 1 second. Here we are. And here we go. So I'm here tonight as a representative from the Easthampton Health Department, where I work as a public health nurse. I am also here as someone with a background in public health. related to mental health. And so I wanted to talk with you a little bit about teen mental health issues. But first of all, parents, how are you all doing? As a parent myself of teens, actually, I know that, I know a couple things. One, this has been a heck of a year for all of us, and our own mental health has taken a beating. Not just because of our own situations with work and managing this pandemic on the home front as well, but also, as parents, there's been a lot that our kids have been going through, and, really we've probably gotten the brunt of it, or we've been the first to notice some concerning things, and we've had to hold that and deal with it. So, I'm talking to parents right now about, taking care of yourself first. I'm sorry, what's that?
Your screen isn't shared.
Oh dear, I'm sorry. Hold on. Share screen. Here we go. I'm so sorry. All right. Can you guys see it now? Are we here?
Yep, you got it.
Great. All right. Restart. Thanks. So again, thank you for inviting me. I am currently a public health nurse working with the Easthampton Health Department, and I have had recently quite a bit of experience with some pretty significant young adult mental health issues as a psychiatric nurse. I am a parent myself of 2 teen daughters, and so I do have the day in and day out experience of dealing with teens, especially right now with COVID, and just seeing all that data from the SPIFFy Coalition. Wow, a lot of that really hit home, I have to say. I don't know about the rest of you. So my first question tonight is, parents, how are you doing? Like I said, I'm just really thinking about you, wondering how you're handling all this. This is so tough for everybody. So I want us to think first, when we talk about how to help kids, let's put on our own oxygen masks first, right? This is the number one priority, how to take care of yourself as parents, not only so you can be a better parent, but also so you can model the behavior and the coping strategies that you want your kids to practice and learn to pick up in their own lives. So let's talk about that. What are ways to promote well-being? And I'm, again, focusing on parents trying to help kids, but also let's think about how this helps ourselves too. And I know that COVID really, especially people working from home or who had been laid off during the pandemic, a lot of this really went out the window. And I think this is why our mental health as a country, as a world really has really had a beating. And so we're all let's be kind to ourselves. It's going to take a while to recalibrate and kind of get back to some of the things that we know work that we weren't able to do before. So the first thing I have here is to encourage responsibility in our teens and just some basic stuff, right? Let's help them, encourage them to take responsibility for being on time to school, getting to the bus on time, not reinforcing sleeping in and then, yes, I'll drive you, really trying to be firm but kind and help support them. One of the routines we have every day is I'm the one who loads the masks with the filter, right? So, everyone's getting their shoes on, they're getting their lunches and all this, and I'm like the last one before they get to the bus. All right, your mask has its extra filter, you are safe and you are good to go. So we have these rituals that we start to build. Chores, of course, important, even a job. I mean, some of us might be a little concerned about kids being out in the world right now, but we have the vaccine available now to them. And there's a lot of reasons to believe that it's a much safer place than it was even just a few months ago for kids to be out in the world and working and having part-time jobs. Building in structure. This is, again, everything kind of went out the window with COVID, but this is the time to think again about maybe having a weekly dinner together as a family, whatever your family looks like. Maybe building in something that we do once a month. The kids pick an activity or something. For us, it was resuming game night. We were really sick of each other for a while. We did not want to do any kind of game night, but with them back in school full time, we do want to see each other a little bit in the evening. So that's what we're doing. This one I think is so important for anybody who has a background with outdoors and has an understanding of the connection with mental health. This is so crucial. Our biology connects us so much with nature, and to get our kids outside. Maybe we combine some of this. Maybe once a week we do chores outside, whatever that might look like in your particular home or environment. Maybe we take a walk together Sunday afternoons or something, but something, and you can model it, and that helps kids to see it as normalized. Maybe they invite a friend, and that's like a safe activity for them to do. Encourage your kids to go on walks with friends. This one, next one, putting your phone down. This is so hard. I struggle with this too, especially because a lot of us are now working from home. And so you feel like you have to respond constantly. But I've seen with my kids, like a lot of times it's a split second where they are looking to you to respond or to get your attention. And it's so easy to miss that moment because you're looking down at your phone, catching up with social media or connecting with people, trying to tend to your own needs, of course. And then you miss that chance when they want to actually open up and maybe tell you something. And I can say, having teens, like it is catch as catch can. I cannot predict when they're going to want to express something to me that's important or when they're just jabbering. Like I can't predict that ahead of time. And so I do have to kind of have my own personal discipline around this. This next one, not offering solutions, listening being enough. This is especially crucial when kids are really struggling. So I really want to emphasize this. When teens are ready to open up or to show us through their behavior that they really are having a hard time, it's so easy to move in with solutions that make sense to us. It seems like that's what they're asking for. It's very easy to be miscued on that. But if we reflect on our own experiences, if anyone who's ever done therapy knows, like mostly you just want someone to listen. Mostly you just want to get it out. And so when we're lucky enough to have kids who feel safe enough to do that with us, listening to them is our primary goal, and really can have the greatest impact so that they will feel heard. And even that will feel validating. Looking for opportunities to connect without forcing them. A lot of times this is in the car. Any parent knows this. You know, maybe they have their headphones in or not, but if they take them out, maybe that's when they're going to talk about whatever the thing is that's bothering them. So maybe not keeping your headphones in. That's what I think about, is like, how can I just be present and available? Showing your interest regularly, not just, but I think of it, I know I have this tendency, once or twice a week, I'm like, have you done all your homework? Have you done your laundry? And we kind of get this, almost catastrophizing sort of interest toward them. And it's not the same as, day in and day out. How's it going? How is school? Just kind of, and I know a lot of people are probably a lot better than I even am at this, which is, what was a good thing you experienced today? What was a hard thing? Those kinds of questions at dinner. There's been a lot of information shared about that kind of practice. And then this last one, watch and listen for signs of danger. As you just saw on the survey results from Spiffy, a lot of our kids are struggling to cope, and they are, using unhealthy behaviors, even dangerous behaviors, to try to soothe themselves, try to experience a different feeling. It can be really scary. It's easy to be blind to that, because if we do see it, then we have to do something about it. And it's easy to sort of get into this subconscious mode of, I can't see what's happening, and then I don't have to worry about it. But it might be right in front of you. Not to be paranoid, not to be hypervigilant, just to be, in a reasonable way, open and paying attention, really, which is hard to do because we are all, as we talked about at the beginning, we are all fried and frayed and struggling to get back to our normal balance. So this is a tough place to be, and I feel it for everybody. And looking for those mental health resources, connecting with people, trying to find out what you can offer your child. This is just a couple practical things. Kids are having difficult feelings. Clearly, you saw from the survey results, and we see it in the ways they act out, maybe being harsh with their siblings, harsh back to us in their responses, maybe struggling with schoolwork, maybe struggling to show up for things or leave their room even. So we look at these feeling states, feeling disconnected from others is a very common one, and we all maybe have had it because of the quarantine and the lockdowns and the working from home. So how can we connect again And the second one here in particular, sharing tiny moments, this coping strategy of looking for ways to connect with others. And we see our teens do this naturally with text. They send photos of each other, silly photos, wake up out of bed photos, brushing teeth photos, all these silly things. We can also do this with them too. We can join them in the ways that they are already connecting. And that kind of supports their efforts. Dinner conversations, again, maybe because of a busy schedule, you don't have that many dinners together. But when you do have dinner, try to put the phones down. It's practical and basic, but a lot of us do forget how important that can be. One thing I do, this is really silly, on Facebook, anytime I see a funny video or a meme or something, I just right click and save it. And then I have this whole list of saved things in my Facebook page. And then I just prop my iPad up on a stand while we eat dinner, and we just go through them. We watched all last night, babies dancing. It was just ridiculous and silly. Sometimes it's animal themed, and it doesn't even matter. It's just a way to connect a little bit. And they know I've been thinking about them when they weren't around, and that sort of thing too. Feeling without purpose. This is really common for a lot of us. We're reevaluating our lives in the wake of this pandemic. And when we lose our structure, we lose our mooring and our feeling of like what we feel connected to and what matters to us. And so, there are some basic things. We can return to activity, sports and hobbies and things that used to give us like a reason to get out of bed in the morning. I know one of my teens is really not into school right now, and always she was before. I don't know what's happened. I don't know if it's the pandemic. Maybe it's being at home. Who knows? But now we're trying a new sport, as a new way to kind of have a reason to go to school each day.
I'm just going to hop in and do like a 1 minute wrap up kind of warning.
Oh, sure. Yeah, I've just got one more slide actually. So this one is specifically to the questions that were asked, I think, on the parent Facebook page. I want to talk about, is it safe to go back? I think most of us are looking at all the signs. Yes, it looks very good to go back. But this one slide just really focuses on educating and empowering our youth to reflect about the safety issues and, the factors that they need to think about. What is our transmission risk locally? Thankfully, it's been really low. What is your own immunity status? That of the people that you're around. Knowing that people are staying home now if they're symptomatic, like that is a general practice, thank goodness. Is it outdoors or indoors? All these different things make something safer or less safe. And just at the bottom, and this is probably a good kind of overall mantra right now after a year of things we could not control, our goal is to reduce risk. And I would add here, our goal is to just generally look to improve our lives, not imagine we can control any of it. Okay? So just let it go, but pay attention and try your best. Thank you so much. I appreciate the chance to talk today.
Thank you, Amy. And Amy can be found within the city of Easthampton as our public health nurse. So thank you for that. And I am going to introduce our next panelist. It is Shannon Hicks. She is a licensed clinical social worker who has worked for the Center of Human Development for the past 15 years. She has worked in both the Children and Families and Clinical Division of the agency and is currently a director at one of their outpatient sites. Shannon serves on multiple task forces in the region and has been on the executive committee of the Easthampton Healthy Youth Coalition for the last 5 years. Shannon, welcome.
Thank you so much, Rebecca. So I'm not going to be sharing my screen. I'll just kind of be talking, and at the end I'm going to put some numbers and some contact information in the chat so that people have it if they need it. I also want to validate that this has been a very difficult 14 months for everyone. And I just appreciate you taking the time this evening to explore effective ways to support the children in our lives. I'm going to break my piece up into 3 different segments. So from my standpoint as a clinic director, I'm going to talk about, what we know, how you as parents and caregivers can help, and then also what resources and referrals are available to us. So So what do we know? So in the outpatient world, we have seen a significant increase in mental health experiences amongst youth. These could be pre-existing mental health conditions that are now amplified by the pandemic. And we've also seen clients who have come in with an onset of a mental health experience due to the past 14 months and what the pandemic has, how that's impacted them. Depression and anxiety are two of the main mental health experiences that are being reported to us in the outpatient world. And we're also seeing the awareness around family stress and what that looks like. Children haven't been able to get out of the home. They've been privy to conversations and situations between the adults in their families that, 16 months ago, that might not have been the case because they weren't at the house. They were out with their friends. They were at a friend's house. They were at a sporting event. They were at a school event. Children are home more often, and the weight of the stress in the house in general is weighing on them tremendously. When we talk about how you as a family can help, and Amy kind of touched on this a little bit, validating by listening and sharing your experiences as the adult in their lives related to the pandemic, that is so important. And again, it's not about solving the problem, but just being present to listen. And that in itself validates the youth in your life, that validates their experience. And I just think it's important to remember that for adults, it's our initial response to, yes, want to solve the problem and figure out how to make things better. But, we haven't been through this either, and we're scared and we're sad. And this is really difficult. And this is one of the times that the way to be strong for the children in your life is to show your vulnerability and to be able to sit with the youth in your lives and be able to say, yeah, I'm really having a difficult time too. And I miss my friends, and I miss going out and doing things also. And that's how you're strong for them, is to show them that they're not alone. It's also really important, and I know this can be really challenging, but it also showed in the data, to try to stay as connected to the extended family as possible if you're able to. The family connection, especially right now, because in the immediate family, relationships are a little strained. The extended family can be a huge support for the youth in your life. Also, to be an example, and if you want your child to be in smaller groups and to wear masks when they're outside, you want to hold them to the same standard that you're holding yourself, because the thing that we want to try to do is minimize as much confusion and as much stress as possible. In relation to some of the questions that we saw, as far as people and families who are approaching COVID differently, to try not to judge, be supportive, help your children figure out what makes them feel safe and how to communicate that to others if they are interacting with people who maybe don't have the same standards or aren't following the same guidelines that your family is. You want to help them to feel comfortable to explain or to communicate why they are making the choices that they are making. Also, just how to adapt effectively to all of the change that's happening. is to try to go as slow as possible. You know, I think we're all sort of in this rush to get back to our new normal, which is great. And I think we all need a light at the end of the tunnel, but it's also okay to go slow and to support those steps kind of one by one. And we really want to try to reduce vulnerability factors amongst the youth. So that's, you know, sleep hygiene protocol, making sure kids are going to bed at a reasonable hour, eating balanced meals, being as physically active as possible. All of those things, it might sound so basic, but those things are going to help them to stay emotionally regulated, which is really the goal. As far as resources and referrals, I will be the first person as a director of a clinic. We have 7 outpatient sites in CHD to say that referrals have increased significantly at all agencies, and with private practice too. And wait lists are long, and they are long especially for people who have private insurance. Higher levels of care, so inpatient, partial, they're at limited capacity, they're being done virtually. And so there's just not as many resources like that available. We are working really hard at CHD to minimize wait times for people, no matter what the insurance is, and just have an open access model, because that's just what's needed right now. School staff, you know, again, in the PNES data, it shows school staff, they make a difference in children's lives. And I think that as parents and caregivers, it's so important that we reach out to school staff if we see any concerning behaviors, if we want to check in, because the kids really do feel supported by the teachers and administrators in their school. Also to reach out to primary care providers, you know, they can be kind of a first stop in some ways, and they can also support with referrals. And then, you know, there is outpatient level of care services. So therapy, individual, family, group counseling, in-home support, and therapeutic mentoring. And those are all just different resources that can be accessed and could be helpful. In the chat, I'm going to put my direct contact information, so my email and my phone number. And then I'll also put the intake number for CHD, which is the number that you would call, and they'd set you up with the closest clinic possible to have an intake done. Also the crisis number for Hampshire County. There's also a text line, a crisis text line, which is something that we give out to a lot of the teens that we work with, because crisis offers phone support on a 24-hour, 7-day-a-week basis. But teens don't like to talk on the phone, typically. They like to text, and there is a text line, and they can reach out and get support via text. And then I'm also going to list put in the chat the number for Community Action, which is just an amazing resource. And they, if anyone's doing anything to support youth and adolescents in this region, they're doing it. So it's just important to have that contact info, and you can reach out if you have any questions. So thank you, everyone. Again, I appreciate the opportunity to speak, and I'll put all that info in the chat.
Wonderful, Shannon. Thank you so much for sharing all of that information with us. All right, we're going to go to our final panelist, Dr. Jonathan Schwab. He has been practicing pediatrics for over 30 years. He is the medical director at Northampton Area Pediatrics and is a school physician for several of the schools in the Pioneer Valley. Thanks for joining us, Dr. Schwab.
It's my pleasure. Thanks for inviting me. Everybody has done a wonderful job in explaining how this pandemic has influenced the behavioral health and mental health aspects of our children. So I think I'll save my comments to maybe something a little different then. I'll talk a little bit, and just for a few minutes. I don't have a presentation, but I wanted to give people an idea of how COVID has affected our community through our practice, and maybe say a little bit more about the physical aspects of this pandemic. So for those of you who don't know me, I'm, as Rebecca said, I've been in practice for a fairly long time. And my practice is Northampton area pediatrics, and we take care of a lot of kids in our community. We have about 12 providers and over 10,000 patients. So what has our experience been over the past year? Well, what we have seen is that COVID, while we have had patients with COVID, COVID does not physically affect children the way it does adults. And there's particular reasons for that, which if you're interested, I can get into the physiology of how children are different than adults. But this has been the only blessing that I can think of about this pandemic, is that I have not been nearly as busy for the physical aspects of this disease as my adult colleagues. At our practice, over the past 12 months, we've seen about 250 cases of COVID. The vast majority of those cases have been children who have not been particularly sick. The age ranges have been from newborn to adult. We do see still some adults. Most of the children and patients have presented with fevers, cough, runny nose, the typical things you might see in the winter season. And in fact, a good percentage of them have had no symptoms. I, in fact, saw a newborn who was positive for COVID. The parents were fairly sick. They were coughing, they had fevers, they were not comfortable. The newborn looked like any other newborn. It had no symptoms at all. This is in stark contrast to many other illnesses that I take care of, where the babies and newborns are much sicker when they get infections. We have not had any hospitalizations of those 250 children. So this is, again, a blessing. We have found that most of the transmission in our area has not come from gatherings of large groups or in schools, but has come from home or maybe close friends. And that actually is very consistent with what's being found throughout the country. This is another reassuring aspect about this disease, and that is that children don't seem to transmit it as much, and through certain basic types of protections, distancing, masks, ventilation, that it can be reduced significantly the way this virus is transmitted, so that schools, which are now back in session, not all of them, but many of them, are showing that they can actually do this in a safe way. And in fact, many school systems throughout the country have been open throughout the year and have not shown the transmission rates that many people had feared. I think, to put it in perspective, I think it's helpful for the physical aspects to think about it in the same way that you might think about other viral infections that you're familiar with. And that is, the most common one would be flu. Everybody has lived through an influenza season. So while the virus is different, I'm not going to say that coronavirus is the same as influenza virus. They have different DNA structures and so forth. They both have some things that you can think about, because we've all lived through a flu season. And when it comes to pediatrics, flu season and deaths are about the same as COVID deaths over the past 12 months. The symptoms of COVID are actually milder than I see when I see a typical flu season, where the kids are sick, they're feverish, they're breathing rapidly. Kids generally are not doing that in our office. In addition, the younger kids in the high risk category for flu is not what we see with COVID. And asthma, for example, which we do see is a risk factor in influenza, is not seen as a tremendous risk factor in COVID. COVID has been a huge problem for adults, but it has not been a huge physical problem for kids. Kids are not the driver of transmission the way they are for flu. So there are a lot of differences, and that's actually, again, reassuring to me as a pediatrician. But this pandemic has clearly affected children significantly, as you've heard before, I've heard of the previous speakers. And I would call this the unintended consequences of keeping our people safe in our community. And that's what people are talking about. And we have certainly at my practice have seen a huge increase in anxiety, depression, ADHD, well over 30% of number of visits. If you look at my prescriptions that I do in a given day, anxiety, depression, and ADHD far outnumber any antibiotics or asthma medicines that I give right now. I never thought I would say that. I can hardly remember the last time I prescribed amoxicillin, which is pretty incredible. But because of all the quarantining that has been done to save people's lives, we have seen not only difficulties in learning, which you all know about, the remote access learning, but we've also, children have been taken away from the typical things that reduce stress. That is, friends, they've been isolated, getting exercise, sports programs have been decreased. And as a consequence, we are also seeing an increase in BMI and obesity because of the lack of activity, as well as the increased access to food in our environment, in their environment at home. So what's the good news? And there is definitely good news. The good news is that I really think we're turning the corner here. The numbers have been decreasing over the past few weeks, and I think that the numbers are going to be similar to the numbers of the summer. And then the amazing news from yesterday was that a vaccine has now been approved for children 12 and over. And that's being implemented even today in clinics in cities around in our community. And I know that Easthampton is planning on doing community clinics for just kids. And if you don't have the ability to do that, I can get you that. I got an email a couple hours ago of how that's being done. That's very important because the vaccine is incredibly effective. It's incredibly effective in not only preventing disease, but preventing spread of the disease. It's incredibly effective in preventing serious disease, hospitalizations. So if there's one thing I'm going to suggest is that you get your kids and yourselves vaccinated. Hampshire County has done a pretty good job compared to the rest of the country. About 50% of those over 18 are fully vaccinated in our county, and that's really very good. And that's the best way of getting herd immunity and getting over the other side of this pandemic. Now, there are some uncertainties and caution. Yes, there are variants, and the UK variant is the most common species of the virus now in our area. There are others, Brazilian and South African and even Californian. So there are some uncertainties. However, the vaccine has been found to be effective against most of these variants, and that's very reassuring and very good news. But as we get more comfortable in going outside and doing things, often restrictions are decreased appropriately, but we need to do it appropriately, and it's a balancing act between restrictions and doing things safely, and the negative consequences, as we've just all talked about, of what those restrictions bring about. So this balancing act between herd immunity and restrictions is something that we'll continue to evaluate and make changes every day, because I've been very busy in keeping up with everything is changing, and every week there's something new that we're finding out about the virus, and we try to put that into our practice. The last uncertainty is vaccine hesitancy, and I just feel again that if you have concerns about the vaccine, please bring it up with your primary care provider, and they can explain the safety of this vaccine and how effective it is. And I strongly encourage you to get your kids vaccinated, and that's going to be the best way that we can get out of the other side of this pandemic.
Thank you so much for all of that. And I have to say, it was really nice to end on such an optimistic note. That was maybe the most, I don't know, the best news or the best 10 minutes of optimism I've had in a while. So especially as somebody with young kids. So thank you for that. And we have a few minutes to open it up for questions. So if anyone has questions, then you can put them in the chat and I will read them. I know that I had put some questions together before the event, just in case that nobody from the audience had them, but I feel like they were really well answered already. And so, so if nobody has questions for the panelists, that's okay. Let's give it another minute. I love the tips on responsibilities for our kids. Yep, and staying connected. Thanks, Heather. And thanks to everyone who put information in the chat as well.
And if anyone wanted to unmute, we have that power too. So if you want to just wave a hand or anything, you can do that too.
Yeah, Lexi, can you unmute Lexi?
Hi there. Thank you all for your presentations. It was great to hear from the different experts. And I guess, so my name is Lexi Polikoff. I am actually the School and Youth Program Specialist for the SPIFFy Coalition under the Collaborative for Educational Services. And one of the things I'm doing right now is connecting with young people, small handful across the state, in trying to form kind of this Massachusetts Youth Task Force of young people who are really, the main interest is in how to advocate for mental health supports and how to, I mean, it's a very new group, only a few months old, and just support their peers with their mental health. So one of their ideas was to essentially make a policy change in the school student handbook to create a couple, 2 or 3 excused mental health days, just as there are physical sick days in schools. And I was wondering what all of your take would be on, maybe, I know there might be unintended consequences to that. There's worries about, students taking advantage of that, or that I've heard from someone that there might be something about it might be encouraging avoidance instead, of by not, like you did mention, how schools can offer a lot of those protective factors, like being around friends and sports and activity and whatnot. So I was just wondering on whether you think that would be a good idea for schools to implement a policy like that, to allow mental health days.
I mean, I would say that in my field, mental health, behavioral health is healthcare. I mean, it's all the same, and they're related. Your mental health impacts your physical health, and your physical health impacts your mental health. And so, I think that it makes sense for a student to be able to say that they're struggling today, and that going to school would be really challenging for them, just like if they had a fever or if they had a stomach bug. And I think the next step of that is to, just like if your child was so sick and a fever was so high, you would call the doctor, that there has to be a follow-up there, that if your child is feeling so unwell that they can't go to school, because they're sad or because they're scared or whatever it is, that it's the same type of follow-up, and really taking some of that stigma away from the mental health, because people will call the doctor, but they will struggle with picking up and getting their child an intake for therapy, or calling the school adjustment counselor. And I think that's just, that has to be the other side of it too.
Does anyone else from the panel want to speak to that? All right. I'm going to give one more plug for the Easthampton Healthy Youth Coalition. If you have any questions about our work, if you think you may want to get involved, please get in touch with me. I just put my email in the chat. I put our website in the chat. We would love to hear from you, even if you just want to talk about what your family is going through, what you see in the schools, ways that we can support you, ways that you think that we can support the community. We, as a coalition, are really excited to do our best to serve Easthampton and all of the families and youth in Easthampton. So please do get in touch. And thanks so much for tuning in. And until next time, thanks so much. Have a good night, everyone. Thanks to our panelists.